Most people assume that a toothache is a dental problem, and they're right. But when that toothache becomes a tooth infection, it stops being just a dental problem and becomes a medical one. Here's the distinction. A toothache is pain. It could be sensitivity, a cracked tooth, or a cavity. Uncomfortable, but contained. A tooth infection or a dental abscess happens when bacteria enter the tooth's pulp, the soft tissue inside of the tooth. Once bacteria build up there, well, they can multiply fast. Pus can build up. The infection puts pressure on everything around it, and if it doesn't get treated, it spreads. That last part is the thing people underestimate. A tooth infection doesn't stay in your mouth. It can spread to your jaw, to your neck, and the tissue around your airway. Some people end up with complications from untreated dental abscesses that include their brain or their heart. It can happen because what seemed like a bad toothache really turned into a systemic infection through the bloodstream. The warning signs: throbbing pain that doesn't quit, swelling of your jaw or cheek, fever, lingering sensitivity to hot or cold, or a bad taste in your mouth from the drainage. If you get those symptoms and you can't get to your dentist today, ChatRx can help bridge that gap. Antibiotics are a bridge, not a fix. I want to be clear about something because I think it matters for your long-term health. Antibiotics treat the infection, but they don't fix the tooth. If you have a dental abscess, antibiotics can bring down the bacterial load, reduce the swelling, and buy you time. That's real and that's valuable, especially when you can't get to a dental appointment immediately, which in a lot of parts of Indiana, Illinois, and Michigan can mean days or even weeks of waiting. But the infection can come back if the underlying dental problem isn't addressed. The tooth still needs treatment, and whether that's a root canal to save it or an extraction if it can't be saved, antibiotics alone are not the long-term solution for a dental abscess or infection. So here's how I like to think about it. ChatRx gets you the antibiotics you need today to control the infection and manage the pain. Your dentist actually fixes the tooth. Those are two separate steps, but they both matter. The mistake people make is getting the antibiotics, feeling better for a few days, and never following up with the dentist. That's a mistake. The pain goes away, the swelling goes down, life gets busy, and 6 months later the same tooth is infected again, but this time worse. Get the antibiotics, make the dental appointment at the same time. Don't let feeling better be an excuse to skip the follow-up when it's an emergency. Most tooth infections caught early can be managed with antibiotics and a dental follow-up, but some of them just can't wait. Go to an emergency room, not a telemedicine platform, if you have any of the following issues. Swelling that's spreading into your neck or towards your throat. This can compromise your airway, and if it moves fast, it can be very serious. Don't wait to see if things get better. Difficulty swallowing or opening your mouth. That could be a sign that the infection has spread to the deeper tissues of your neck. Fever over 103, especially when combined with severe swelling. High fever with dental infection means bacteria are winning. Chest pain or difficulty breathing alongside the dental pain. It's rare but serious. Dental infections can, in extreme cases, spread into the chest and the heart. If none of these apply, you're dealing with a painful, urgent problem that still needs treatment today, not next week. That's where ChatRx fits. You answer a few questions, our clinical team evaluates your symptoms, and if antibiotics are appropriate, your prescription is at your pharmacy within minutes. And then you call the dentist the same day. Don't wait, don't put it off. That's step 2, and it's critical. I'm Dr. Tod Stillson. I'm the founder of ChatRx. We're here for that gap between when you need care and when you can't get it. For just $25, no insurance. Go to chatterx.md now.